Have you ever seen a wisdom tooth that's wrapped around the inferior alveolar nerve and you ever wondered, what the heck do specialists do in this scenario? Well, if you've never heard of the code D7251 or coronectomy, this is a video for you. Hey doc, I'm Dr. Jared Williams, and you may not know me, but I want to let you know I'm your third molar expert. I've completed over 10,000 surgical procedures, and I want to let you know if you're a GP who's pondering about taking their skills at next level with third molar surgery, I want to inform you that we train GPs with little to no experience to be proficient in third molar surgery in less than 4 weeks. So if you want to take your skills at next level, you arrive to the correct channel. All right, let's jump into it. All right, so if we look at our screen today, we're going to talk about a coronectomy. A coronectomy is basically where we take the crown of the tooth off because the patient's in pain or there's pus or different things along those lines, some type of symptom that's present. And the whole purpose that we do that is to prevent any damage to the inferior alveolar nerve. So the code that you would use with this treatment diagnosis is going to be D7251. Now, you've probably never ever seen this code, and it makes sense because you probably are doing general dentist procedures. But if you're a GP who wants to take their skills at next level and be superior to all those other docs that are out there, well, take some notes, get your pen, pad ready, because I'm going to give you some game that's really going to allow you to one-up your classmates and colleagues. The actual code, right? A D7251, a coronectomy. So big word, corn meaning crown, and ectomy meaning removal or cut. So if you ever seen this type of tooth, this is what it looks like, the presentation. So you could see that the nerve is coursing through or past this third molar tooth right here. And you could see that there's also symptoms, that there's pathology or follicle that's present around the crown. And then you could also see that the tooth is wanting to force its way into the oral cavity. But as you can see here, it doesn't look like there's going to be any room to accommodate that tooth. So what do? You take it out. Now, when I got started, I had no clue about this code. As a matter of fact, I was doing it without coding for it, and that's not how you want to do it. Everything you do, you want to have a why. So when I stumbled upon this code, I was like, wait a second, I could take the tooth out, just the crown, leave the roots, and get paid for it? Well, yes, you can. It's called D7251. Now, I challenge you, don't be trifling with this, all right? Don't be one of those doctors, because we have enough sorry, lazy behind doctors that are present. And if you're one of them, it is what it is. But there's nothing wrong with being ignorant. Just don't stay there. So if you look at this code right here, this is the code that I want you to use. And the rationale is you could take this tooth out, maybe 15, the crown, out like 15 minutes and code for it. Now, there's specific ways in how you take this out. But today we're going to specifically talk about some of the problems that are associated with these types of cases.
Are you a GP tired of referring patients out of your practice and losing out on production? Did you know third molar surgery is a $3 billion industry? If you are ready, join the 5-day third molar surgery challenge, which will give you the confidence, knowledge, and skills to remove third molars safely. During this challenge, you'll enhance your surgical speed and gain exclusive access to insider secrets that specialists for years have tried to keep hidden. By learning these techniques, you'll be able to serve more patients, add more skills, and be the go-to doctor in your area. Don't miss this incredible opportunity to boost your skills, increase patient volume, and revolutionize your practice. Enroll now and let's embark on this exhilarating journey together.
Now, there's a lot of controversial aspects about this code because it's like, well, you're getting paid to do a procedure that you really didn't complete. Well, it's just like, that happens all the time with endo. And so, as a GP who gets referred to and actually refers things out, I want to give you some insight that as long as you have the rationale, you're operating by evidence-based dentistry, you have a mentor who's been there, done that, and has all the t-shirts, tickets, rides, and temporary tattoos like my daughter likes to have all around the house. These are the different things that you want to have when you are going to perform this case. And it's real simple, especially when you are letting your patients know. And I always like to let my patients know prior to, before I even get into the case. And this is how you do it. You say, hey, John, I see that you have this tooth over here that is impacted. And a couple things that you could do. Number one is this. We can do nothing. Number two, we could take the tooth out. Now, if we take the tooth out, there's a couple things that could happen when we're taking the tooth out. Number one is that we take the whole tooth out, right? Everything works out. But if we don't, what will happen next is that we'll end up doing a coronectomy. And a coronectomy is basically where we take the whole crown off and actually point to it and let them know that we're going to take the crown out. But then we're going to leave the roots. And that's when everybody says, well, what do you do next? I don't know what to say. I don't know what to say. Now, you say this. You say two things that typically happen. Number one, the roots will just sit there, won't cause you any issues. Or number two, the roots will work their way up and it's easier to just pluck that way. And that's it. Now, I'm pretty sure you're asking, well, what do I say if the patient says, well, what happens? Well, you answer their questions efficiently and effectively, and you have to have confidence in doing so. So with that being stated, this is your code D7251, a coronectomy. Now, guys, I wish I knew this information before I got started on my third molar journey, because I would have had so many more peaceful night sleep and rest. But in the event, I had to go on this journey so that you can learn and pick up where I ended up starting my journey. And if I could do that for you and shorten your learning curve, hey, that's what it's all about. It's all about having the world smile at the surgery. So there's your code. I hope you learned a lot about it. If you want to debate me down in the comments, I would like to see how many coronectomies have you done, on purpose that is. I would like to know what kind of fees you're actually being able to charge out for your coronectomies, and then how long would it take for you to actually complete these types of cases? Because I want to let you know there's a lot more out there than you believe, and I also want you to let you know a case like this will allow you to recognize what looks hard is often easy. All right, GPs, you have a phenomenal day and make it a great one.